Abdoulaye Abubakar Sese is a survivor of TB, but the experience was not easy. He says his boss fired him because he contracted the disease, and his friends and first wife abandoned him while he underwent treatment.
I was so devastated and I feel so isolated. I feel so bad.
Sese says in general there's stigma and lack of awareness about TB.
It can always.
So now he spends time educating people about the disease, which is preventable and curable.
Don't worry, you'll be cured.
Sese also has created a volunteer advocacy group. Using training techniques such as role-playing, these volunteers are also learning to work in communities to help raise awareness of TB prevention and early diagnosis. The World Health Organization estimates that in Sierra Leone, about 20,000 people were infected with TB and just over 3,000 died from it in 2015. Globally, there are 1.8 million TB deaths that same year, making it the top infectious killer worldwide. Poor housing and sanitation, along with factors like HIV, tobacco use, and diabetes, can all put people at a heightened risk for TB. And another challenge is the emergence of multi-drug resistant TB. That's when a patient does not respond to anti-TB drugs. One reason this happens is because patients do not always finish their medication. The initial treatment for TB is 6 to 8 months. If they stop, it can cause drug resistance. The WHO estimates there's almost 500,000 people in the world who are TB drug resistant.
WHO is monitoring the level of resistance in the countries. Overall, there is not an increase, but we are finding more and more patients because we're looking for them.
Testing equipment introduced last year helps detect multi-drug resistant TB faster. Sierra Leone has started using it. And the WHO also introduced a shorter, cheaper regimen for multi-drug resistance TB last year. The country's recent Ebola crisis also affected TB care and prevention. There was a reduction in patients seeking care and follow-up during that time.
Because of this challenge of the Ebola in the facilities and the amounts of screening and what they have to go through, and the thought that they might be diagnosed as having Ebola made them not come back.
As for Sese, he's grateful he is healthy and that he's around for his kids. He says he will keep doing his part in Sierra Leone to help stop TB. Nina DeVries, Al Jazeera, Freetown, Sierra Leone.